Good morning. It is nice to see you this morning. We've got a beautiful day and a pleasure to be able to be here with you, at least for a few moments. I wanted to be sure that you were aware of the fact that today is the last day that Dr. Player is with us, and while that is kind of a sad occasion, we'll have him back again. I know you've been blessed by him. But next weekend, we will have a presentation, the presentation that we do every year by the folks, the students and adults who are part of the mega mission trip to Moore, Oklahoma. And they have some great stories and some images to share with you to sort of help you understand the work that they did in the name of our Savior, Jesus Christ. But for right now, I want to introduce to you my dear friend and my physician, Dr. David Player.
Thank you, Will. Thank you. Well, good morning to all of you. Anybody here for the first time from the 4 weeks here? Please don't do that to me. Oh, my. Okay. All right, this is kind of a 4-part lecture series, and they've all been building on each other, but I've tried to summarize each week and kind of go over where we were last week and hope that nobody got left out because of that. But those who are here for the first time will have to kind of catch up and maybe do the DVDs or CDs that have been recorded the past few weeks. But we've been talking about our bodies, and we began by saying that the psalmist told us that we are, now knit me together in my mother's womb, has known my reins. I'm fearfully and wonderfully made, and every one of us was fearfully and wonderfully made. We may not like the way it turned out, that we're not as tall as we want or as strong as we want or as something as we want, but the fact is each one of us is made in the likeness of Christ, and he made us well. And then we found in our verses in 1 Corinthians that we were going to be responsible for taking care of the temple of the Holy Spirit, and we've dwelt on those verses. And so that's why we're learning as much as we can, and over time God teaches us about our bodies and how to take care of them. So that's what we've done. And I've tried to divide this series, for any of you who haven't been here before, into 5 or 6 parts that compartmentally we need to be healthy and care for our goods. We need to have good body composition, which is good muscles, good bones, and good fat. We need to have good nutrition, which we said was focused on understanding what protein, carbohydrate, fat, and alcohol and protein and fiber are in our foods, and know how to get the right amounts of any or all of those. We know we need to have good fitness, and we talked about that last week. We talked about the different components of fitness, that we need to both be strong, particularly having strong pectoral muscles and strong thigh muscles, so we can carry ourselves when we have to walk to the bathroom when we're old. We need to have good flexibility. Somebody brought me up a little saying last week and says that he who is flexible will not get bent out of shape. And that was probably better than anything I said last week. But we said being flexible means I can reach down and touch my ankles, kind of, and I can get my knees up against my chest, and those kinds of things help us not be injured when we fall down. And then we talked about aerobic capacity, the capacity to walk uphill on the treadmill, or to walk up a hill carrying a box. That has a strong correlate with longevity. We said that for the first 2,000 calories a week that we doing anything, any kind of work, we have an improvement in longevity. Remember, we said that for the first 2,000 calories a week that we expend, we have a steadily dropping death rate. And then we get less for our nickel as we exercise more and more and more every week. And finally, at the end, if we do too much, we have a higher death rate. But most of us are over here on this part of the curve, aren't we, where we don't get quite enough activity, and we have to work to get it in our sedentary society. So that was what we talked about last week, and we then talked about Dr. Cooper's paper last week, which looked at the issue of how long can you stay on the treadmill? Can you walk up a hill carrying something? How hard is it for you to do that? And we divided, remember Dr. Cooper's study or Dr. Blair's study looked at the difference between people who go 6 minutes, 8 minutes, 10 minutes, 12 minutes, and 14 minutes on a Bruce treadmill protocol as an exercise. And we found out there was almost a 5 times difference in death rate between 2 identical women one of whom did 6 minutes and one of whom did 14 minutes on a treadmill. And in my experience, to be able to have that kind of good treadmill time, 14 or 13 or 15 minutes or something like that, some of it's, of course, age-related. I can't do what I did when I was 50 now. But the secret is to do things that make our hearts beat fast and make our lungs breathe deeply, and actually plan for those things during the week. I didn't mention the Apostle Paul's famous verse on exercise, in 1 Timothy chapter 4, verse 8. He said, avoid foolish and old wives' fables, and exercise thyself rather unto godliness. It says, for bodily exercise profiteth little, but godliness is profitable in all things, having the promise both of the life that now is and that which is to come. Great wisdom by Paul, huh? So he didn't say don't do exercise. He said just don't be nuts about it. And there are a lot of people today that are kind of nuts about exercise, they go to the club 5 days a week and they work out. You see them, people who run 50 miles a week. That's getting it out of balance. But it is an important thing for us, and we should remember it. So we've been through those three things for those of you who've come: a good body composition, good nutrition, good fitness. And today we're going to go into various forms of poisoning. And I'll not spend any time on spiritual health. You guys have a wonderful spiritual health resource here. Suffice it to say that spiritual health is one of my 5 disciplines that I think people should have. We should have a right relationship with God through Christ. We should be in the Word of God, studying, memorizing, meditating. We should spend lots of time talking to the Lord. And that sort of behavior has a health benefit, believe it or not, when people study it. It doesn't surprise us as Christians, but it does have health benefits. People who know the Lord and who are in His Word and who pray are much less likely to be anxious and depressed and angry, even though we all have those emotions in us. So I'm not going to spend much time on that today. I'm going to focus on poisoning, and then I'll spend a little bit of time at the end, if I have it, talking about the last component of our health program, which is how often should I measure something? What should I measure, and how often should I measure it to see how I'm doing? Everybody with me? Okay. So poisoning, there's 2 kinds of poisoning. This is a lecture that I could go on for probably give 15 lectures out of it, because each topic is important. But there is external poisoning. And remember, I told you way back at the beginning, you can have a long-distance running program, you can have a perfect body composition, you can be strong as a bull, you can just have everything perfect vitamins, perfect nutrients, everything's great, except your wife is giving you a little dab of arsenic every day, and you will not make it, okay? Okay, I'm sorry, I should have said it the other way around. Your husband is poisoning you every day, but okay. Anyway, the truth is, we all kind of know that, you could be perfect in every other way, but if you're getting poisoned by something, somebody's giving you a little dose of something every day, then you won't make it very well, and you won't live to be old. And so I divide this lecture into external poisoning and internal poisoning, okay? So what's the single biggest environmental exposure that has cost us more health than anything else in the last 100 years? Smoke. Yeah, I knew somebody'd get that right. Somebody. Combustion products kill people. Combustion products kill people. And we people have been smoking things for the last, thousands of years probably. But the fact is that we know now that if you want to end up with atherosclerotic plaquing in your carotid arteries or your coronary arteries or your legs or any other place in your body, and you want to end up with an increased risk of malignancy of almost every organ in the body, then just go ahead and breathe smoke every day. As I always tell people, if you were trying to get 200 bushels to the acre out of your cornfield, you wouldn't go do a smoker and smoke it all every day. It wouldn't give you 200 bushels. Neither will we as human beings get 200 bushels for breathing smoke. It's an interesting thing about smoking, and you may remember I've talked about it before, that people smoke to be able to get nicotine, really. Nicotine and a few other amines that are in smoke. But the nicotine really doesn't cause very much disease, but the smoke causes lots of disease. And we know now even children who were raised in homes of parents who smoked have many more diseases than those who were raised in smokeless homes. So I would admonish for your grandchildren, your children, everybody around you, probably every kind of smoke. Even firemen don't have as good a longevity as people who work in other professions. And again, the same principle again, that they breathe a lot of smoke sometimes when they're doing their job. So cigarette smoke is toxic to us. Almost every kind of disease is doubled or tripled in death rate because of the exposure to smoke. But nicotine is not. And I always tell people, and when I counsel people, because I try to tell people to make people feel good about what they're doing and not stupid. So when a guy comes in, he's smoking a half a pack of cigarettes a day or 20 cigarettes a day, I tell him, that's not really so dumb to use nicotine. I understand we all use chemicals. We use coffee and caffeine and alcohol and various things, and we're exposed to things, but most of them don't hurt us very much. I said, and nicotine doesn't hurt you much. It raises your pulse a little bit and it raises your blood pressure a little bit. But it's the only chemical, and I'm telling you this because I want you to be able to be kind to your friends who smoke. I want you to be kind and believable to them. And you tell them that using nicotine isn't so stupid because it's the only chemical known to mankind that makes us both more alert and more relaxed. And some of you have smoked and know what I'm talking about. More alert, like I can see the catcher's mitt, yeah, and more relaxed, so I can break off my curveball into the catcher's mitt. Got it? Whereas cocaine, if you used cocaine, you would be more alert, but you would throw the ball into the third base dugout. You got it? And there's all kinds of uppers and downers in life. But nicotine, I always tell people, isn't a terribly dumb chemical to use. It's just that you shouldn't smoke it because combustion products cause death. Everybody with me there? I can't think of a single disease that I know of that is not exacerbated. It's the rate of death and the rate of progression of the disease is not exacerbated by breathing smoke. So let's all of us tell our children, our grandchildren, our neighbors, and everybody that they're not dumb to use nicotine. And of course, we now have e-cigarettes, and we have all kinds of other nicotine forms that are available, nicotine patches, nicotine gum. I think nicotine gum is the only good studies on stopping smoking have come with the use of nicotine gum. It's because when you thought you needed a cigarette, when you felt your nicotine levels going down, you could grab a piece of gum and you stick it in your mouth and you chew it, just like you do something with a cigarette when you hold it. So I'm not very critical of people who smoke. I simply tell them that it is not caring for your body very well. And if you have to use some other nicotine form for a while to be able to get off cigarettes, do it. If you can cut down from 10 cigarettes to 2 cigarettes a day, do it. It's less smoke exposure. I had a partner of mine who smoked 5 or 6 cigars a day for a long time. And he died when he was 59 years old, and he died of a disease that was specifically related to his cigar smoke exposure. And he smoked a lot of cigars. I used to walk into his office, and there'd be these little black things floating around in the air all the time. You know what I'm talking about. And he actually had a machine that sucked air in and out and got rid of the black things out of the air. But he died he tore his aorta when he was 59 years old and bled around his heart. And he was a wonderful man and quite a good friend, but I'm sure his cigar smoke cost him some life, as it will cost all of us if we do. So I'm not going to deal on smoking anymore, but I want you to be able to tell your friends, nicotine isn't very poison, but smoke is. And we have to find other ways if we're going to get chemicals into our body besides smoking them. And of course, there are other kinds of things that are smoked out in our society, marijuana and other things. And the combustion products are the same. Marijuana actually does have some negative effects on brains and other things too. Secondly, I'll talk for a second about smokeless tobacco. A lot of us in here have used a little pinch between the tooth and the gum, and the pitchers on the baseball mound often do that. And I think they do it for exactly the reason that I just said, that the nicotine makes them relaxed, and it also lets them control their muscles and feel very, very relaxed. The problem with Nicorette gum, as you know, I'm not Nicorette, the problem with smokeless tobacco is it increases the risk of all kinds of mouth cancers. And people get gingival disease and can get oral cancers of all kinds, and those are bad to deal with, as you know. They require both resection and radiation, and so smoke exposure and and smokeless tobacco exposure are both very negative poisons that we have to deal with in our society. And you need to counsel your children, your grandchildren, anybody else you see with the wisdom that I've just given you there. Those are poisons. Those are easy ones for us. Ethyl alcohol is a little bit more difficult, and I talked about that last week. Alcohol is a nutrient. It generates 7 calories per gram, so it's good for us in terms of providing good nutrition. But we said last week that alcohol also blocks fat utilization for about 6 to 8 hours after we use it. So if we're under eating and dieting and drinking 3 times a day, we're kind of in trouble because we can't use our fat for our energy source while we were on our diet. And the reason we are doing our diet is to use up our fat. And if we're drinking several times a day when we do that, we get in trouble. Ethyl alcohol, of course, causes all kinds of other diseases. And most, Dr. Cardell in our office recently reviewed, and almost every malignancy of mankind is doubled in people who drink 2 or 3 drinks a day. So there's no doubt that alcohol can poison tissues, that we should be able to have a glass of wine with our dinners or when we go out with people. Seems reasonable to me, and the Apostle Paul said, take a little wine for your stomach and your oft infirmities, that it may be well with thee. Sounds okay to me. The question is how much and how often. And I think we have to be very careful there, again, because ethyl alcohol is a toxin. It's also more toxic for women than it is for men. And most of you women have probably heard this, but remember that women have less of an enzyme system for metabolizing alcohol in their liver, almost half the enzyme that a man has. And so males, for whatever reason, can metabolize alcohol much quicker than women can, and blood levels of alcohol, therefore, are higher in women than they are in men. So women, it's the woman who, has 3 glasses of wine in the morning just to get through her work morning. Most of you wouldn't do that. But she's vulnerable. And remember the one paper, there are 15 different studies internationally that have been done looking at alcohol and breast cancer. And I hope you girls know that there's about more than a doubling of breast cancer risk in women who drink more than a drink a day, every day. So be very careful, women, about it. I would say feel quite free to drink when you go out to dinner, when you go out with a friend, or in the late afternoon if you want to drink a glass of wine. But be careful about drinking multiple glasses of wine per day because the risk of malignancies, and especially breast cancer in women, increases substantially. And you can Google that subject and read about it. You'll be surprised that you didn't know about it. I think it's because the wine and spirits people do a great job of covering over data on such stuff. So enough about alcohol and smoke and smokeless tobacco. Prescription drugs. All of us have to be very careful about prescription drugs and over-the-counter drugs. There is more poisoning that occurs with over-the-counter drugs and prescription drugs than there probably ever was with any of the things that I've talked about already. And again, you hope that your doctor will give you things that are beneficial, but in our world of subspecialists where the urologist doesn't know what the cardiologist is doing, who doesn't know what the gastroenterologist is doing, or the neurologist is doing, or the so-and-so is doing, we often end up, particularly people in the age group that I'm talking about, end up with a pile of pills in the morning, and you take them in your hand and you chug them down and you say, Lord, please take them where they're supposed to go. I've often thought of the aged lady who, I get a picture of her hands on an x-ray and there's little calcified arteries everywhere. And you can see all this calcium all over everywhere. And she's taking a big pile of calcium and saying, take it to my bones, Lord, not to my arteries. And so we have to be very careful, and we have to keep reading, and we have to trust someone. We'd like to trust our physicians to help us. But in the last 30 or 40 years with the loss of the primary care doctor, the guy who loved you, if you will, the guy who we knew when we were children, that doctor doesn't exist very much anymore. So we often go to 9 specialists, and they all gave us a different pill. And so we have to be very careful about that. And as the public, you have to be very well read and read everything you can read when you get that prescription. Read about it and know about it, so that if you have a side effect, either a short-term side effect or a long-term side effect, you have a chance to know about it. And you need a doctor who cares about you enough to care about what you're taking to be able to let you know the common side effects of the drugs that you are taking. Everybody with me on that? You can see how it's a real problem. And you know it's a problem. The problem is you don't have anybody to counsel you about it. And I just hate that. I can't tell you how many times I've poisoned people with things. I really sweat when I give people almost anything anymore, because I know I've caused so many things to go wrong. The classic case, I've probably mentioned this to you before, and I'll try to not tell too many stories, but the classic case for me is, got a guy who did what I said the last 2 weeks. He gained 20 pounds and got a little bit heavy, and his liver is making an enzyme that causes high blood pressure, okay? And I'm saying he isn't going to lose his fat anyway, so I've got to treat his high blood pressure, not just put him on a diet. And so I put him on a diuretic, okay, hydrochlorothiazide. Some of you sitting here are taking that. That's HCTZ. It's a diuretic. It lowers your salt and water in your body about that much, and it makes your blood pressure go down. It also makes your uric acid level go up, and your calcium level go up, and your potassium level go down, and your magnesium level go down. It also increases insulin resistance and causes people to be more likely to be diabetic. Now, don't get all anxious about it this morning. I'm just telling you. That's 5 things I told you that I know can go wrong with hydrochlorothiazide, all right? So let's say I gave a guy the hydrochlorothiazide and his blood pressure came down nicely, 10 beats, and I'm just tickled pink about that, except 2 weeks later he comes in and he's got his big toe is about this big and this red. And I say, well, Bob, you've got gout. He says, well, how'd that happen, Doc? And I said, well, it's probably your blood pressure drug. He says, well, do I have to take it? Well, yeah, your blood pressure's still high. Okay, well, what do we do about the gout? Well, I said, well, I got to give you these 2 pills. Okay, the one is Indocin. Okay, that's a pill that can burn a hole in your stomach. And the second one is colchicine, which causes diarrhea. And the third one I was going to give him after that is allopurinol, which is a drug that lowers how much uric acid we make in the body. Well, I wrote all 3 prescriptions, okay, so now he's on 4 drugs, right? And he's already having loose stools from the colchicine, and his stomach's upset from the Indocin, and he's still taking his water pill for his high blood pressure. Everybody get the picture? Okay. And then he gets a rash from taking the allopurinol. He's red as a beet all over. He comes back to see me, and he says, what are we going to do about the rash, Doc? And I said, well, just a second. I'll write out for some prednisone, okay? So now I'll give him some cortisone to cover the rash. So I've gone through 5 or 6 pills trying to deal with a guy who just got too fat, who just gained a few pounds and had high blood pressure from it. You got the picture? We got to be really careful. And that's why I always say, as I took care of my mother and dad in my later years, the less stuff they were on, the better they were off. And it's the other reason for us to approach our bodies the way we've done in this lecture series. Good body composition, good nutrition, good fitness, good sleep. Don't get poisoned by stuff. Have good spiritual health, especially have good spiritual health. And then come back and measure something every so often to see how you're doing. Make sense? Let's don't, as much as possible, go through your cupboard today and see if you really need to be on all the things you're on. Talk to your doctors about it. Encourage you to be able to get off something that you're on. Is there some behavior you can do simply to deal with the problem so that you don't have to keep taking that drug? And I'm the last one to say don't take anything from your doctor. For heaven's sakes, we have wonderful pharmaceutical things, but we listen to those ads on TV every day, those ones for Humira and Kindernet and Remicade and Embrel and those things where you see the lady running through the field, just having a wonderful day and everything is great, and then at the end of it, we hear the disclaimer, TB, lymphoma, death, or lymphoma, TB, death, early infection, blah, 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 all those things, and we hear them, and they have to do that. Companies have to put those things in there because people can get really sick from those drugs. Do they make you better from your psoriasis or your Crohn's disease or your rheumatoid arthritis? Well, sure, they do, for a couple of $1,000s a month and a risk of death. You got it? So medicine has a way of trying to, because of economics of medicine, we have a way sometimes of inventing things that are very expensive for all of us. And our whole insurance entry is tied up in this. I want you, each one of you, as you walk away, to say to yourself, I'm grateful for what I have. If it's all that I have, that's good. If there's anything I can do behaviorally to correct the problem so that I don't have to take all this stuff later, that's what I want to do. Everybody with me on that? So we've got 4 poisons: smoke, smokeless tobacco, ethyl alcohol in excess, and prescription drugs and over-the-counter prescription drugs. The one over-the-counter one I want to talk to you about that I think is so important, and I want everybody here to hear this, is remember, a lot of us have trouble with allergies between November and March especially. Stopped up noses, coughs, wheezing, and so forth that we attribute to oak pollen or cedar pollen and so forth. And we go up to Walgreens, and we go to the counter back there in the back left corner, and we look at that big row of things there, and often we find things like Claritin and Zyrtec and Allegra and various other antihistamine things that help us cope with our nasal congestion or our cough. And those things are okay, but I would strongly urge none of you to take the ones that have D stuck on the end of them, okay? That would be anything, Claritin D, Allegra D, Zyrtec D, because the D is a decongestant called ephedrine, ephedrine. And I have seen, ephedrine is basically a drug that looks very much like your adrenaline that you make in your adrenal glands. Got it? And you know what adrenaline does when we get scared, you know, when you're at the end of the Spurs game in triple overtime, you know, right? And your pulse is about 120, you know, and your blood pressure's higher, and you're sweating in your armpits, you know, that's excess adrenaline. Well, ephedrine, the ephedrine, the D, the decongestant at the end of Zyrtec, is a dangerous drug in my opinion. And I say it's dangerous because it causes skipped heartbeats. When you hear of some young athlete dying out on the track at age 30, running around the track, it wasn't a heart attack where the artery got clogged up and got blocked. It was a guy who had a long string of arrhythmias, cardiac arrhythmias, caused by something like ephedrine. And ephedrine is the most notorious of all the things you can take. I mean, caffeine does it to me a little bit, but nothing like ephedrine would do it. Ephedrine is the kind of thing, remember we used to give it to our babies when they were in decongestants, and the kid would sit up at 2 o'clock in the morning and play with his toys in bed. So ephedrine is a stimulant that causes cardiac racing, cardiac arrhythmias, high blood pressure, and everything. Now in Europe, it's used as a diet pill because it decreases appetite and speeds up metabolism. In our country, we're at least smart enough now that you can't get it without going to the pharmacist. You can't go get D off the shelf, can you? You have to go behind the shelf and go to the pharmacist. And the reason for that is because of the dangers of the drug. The real reason for it is because bad people have made methamphetamine out of it. And so that's the real reason that the truth is, I think it's a dangerous drug and it's poison and it probably shouldn't even be there. That it makes some people feel lots better almost immediately in their nose and their airway is absolutely true. But I would not like any of you guys to do it. Please take Zyrtec alone or Claritin alone or Allegra alone or some other antihistamine alone, but do not take D at the end of it if you can help it. With me, everybody? Got it? I've seen at least 10 guys on my treadmill studies over at Health by Design who've had bad arrhythmias, like the kind that I took the guy off the treadmill and had him go down, and I was sweating as I did it because of ephedrine. And it's no respecter of age, sex, or where you work. One of the guys that I took off the treadmill was the CEO of one of the biggest companies in town. And had him lie down, and I was really anxious for him. So don't do that, okay? And there's other things like that out there. Always be respectful of medicines that you're taking. They all have good things. That's why the doctor put you on them. But they all have side effects, and you need to kind of know what they are. You have to trust your doctor to tell you, but in our world where the doctor's seeing 40 people a day and has about 3 minutes for you, you're not going to get much of a coaching on education, and that's why we need these kinds of things like I'm doing. So, okay, so that's all the poisons externally that I'm going to talk about. I want to move to internal poisoning. You say, what's internal poisoning? Well, internal poisoning would be an excess production of any hormone or enzyme or thing that I can measure in your blood. You can get poisoned by your thyroid gland. If your thyroid gland makes too much thyroxine, and I can measure it in your blood and I know it, it's going to make you have a fast pulse, It's going to make you have higher blood pressure. It's going to make you lose weight. You say, oh, give me more of it, you know. No, it's going to make you have loose stools. It's going to make you sweat. It's going to make you feel terrible if you have excess production of, and that's a disease. We call it hyperthyroidism or Graves' disease. And there are a number of other hormones in the body that you can make. I don't want to focus on those. I want to focus on two things that I know are that cause poisoning from within. And the first one is poor sleep. I used it as Dave's Big 7 and Dave's a Big 6, but I want to talk about poor sleep. Sleep being defined as less than 6 good hours a night. Less than 6 good hours a night. And there are now enough studies in the medical literature in the last 20 years to document the number of things that can go wrong with you and me when we do not sleep. And I'll hit some high points of them. The first is that, interestingly, poor sleep, or less than 6 hours of sleep a day, causes people to lose fine motor function. You can't play the piano as well. I wouldn't be able to play the piano as well as I do. You can't type as well as you did before. You can't do other kinds of fine motor things as well. And we kind of know this when we're tired. I've had some of my worst days of my life, you know, flying to Europe and getting off the plane and expected to stay up all day and go visit the ruins of Rome. When I felt so ruined, I wanted to just go to my bed. You know, and going east is bad for those of you who've gone that way. You know, some of you guys are world travelers, but going west isn't quite so bad. But sleep deprivation causes poor motor activity. It causes us to not think as well. People who have not gotten as good a sleep will do much more poorly on examinations of various kinds, written examinations. Of course, it's been well studied. You make sleep deprived somebody, none of us function as well. We kind of know that. Did you know that at least 10 different parameters of our immune system have been proven to not work well after sleep deprivation, meaning we can't kill germs as well as we did before? We kind of know that. Our mothers sort of told us, get your sleep, get your 8 hours or your 9 hours. But we don't pay attention for 1,000 reasons. And since the invention of the light bulb, I think we've lost thousands and thousands of hours of what used to be sleep time for people. People went to bed shortly after the chickens went to roost. And now, of course, we stay up till 11 and midnight. We watch movies. We do all sorts of strange things because of light bulbs and TVs. So the truth is, our immune system doesn't work well, and we're much more vulnerable to colds and flus and all sorts of things. And remember, for the immune system to work well, you'll get cancer if your immune system is chronically defunct, right? So many malignancies are probably aggravated by poor sleep. So a guy who smokes and has poor sleep has triple the numbers of malignancies. Got it? Okay, so we got to be careful. Now, and the fourth thing, the most important thing to me, or one of the most important, is that sleep deprivation causes insulin resistance and can result in obesity. I told you before, the two toxins that cause plaques in your neck, the only two I can say for sure are smoke and high insulin levels. We talked about the main cause of high insulin levels is fat in your liver. So believe it or not, sleep deprivation has been shown in good studies now to result in weight gain, insulin resistance, and increased type 2 diabetes over a period of several years in which people are sleep deprived. Think of that. That's a huge problem. So maybe some of our main problem of our disease that the American Heart Association is studying is just bad sleep. People who didn't get good sleep. And I said, well, why don't people get good sleep? Well, some of it, as I said, is light bulbs and TV sets and working late at night at home. How many times I've worked at night? I've been typing insurance cases till midnight. I can't tell you how many times. And I've probably paid a price for it. I suspect my health is not as good as it would be otherwise had I slept better and slept more. I think my mother and dad slept better and more than I did. So that's one of the things, is just environment. Sleep hygiene, that's called. You don't do stupid stuff and go to bed. You don't watch Spurs games and then plan to go in and go to bed, or a James Bond movie or something like that. You go right to bed and you won't go right to sleep, right? We don't do that. That's because our adrenaline, our ephedrine, if you will, is up to here and not down to here. So we have to be very careful about that. And insulin resistance and gain in body fat, if somebody was trying to do a diet and they found out that poor sleep was causing them to gain body fat. And you say, how does that work, doctor? Well, poor sleep causes cortisol levels to go up. That's the hydrocortisone that's in our adrenal glands. Remember, cortisol causes two things that are bad. Number one, it cuts down the calories you burn per day, but it raises the amount of protein you have to eat per day, or you'll lose your muscles. So somebody who's chronically sleep deprived will have chronically higher levels of cortisol in their blood, well measured in good studies. Chronically high levels of cortisol in the blood has a strong tendency to make us be fat. We gain fat and lose muscle mass. So poor sleep is really a hit, isn't it? It creates a kind of poisoning within us and can really get us in trouble. So the secret is, you say, well, what causes poor sleep then? What are the causes besides the things you just said, Doc? Well, the major disease that causes poor sleep in America is something called obstructive sleep apnea. Somebody here in the room, well, I don't look around and can't tell who you are if you have it, but obstructive sleep apnea is a disease of the last 20 years when doctors began studying people in laboratories at night and watching them sleep. And they found out all sorts of interesting things of it. The test is called a polysomnogram. It's probably, if your wife watches you stop breathing, husband, at night, if you watch your spouse stop breathing, then he or she needs to have a sleep study to find out what's going on. The first symptom of obstructive sleep apnea is often snoring, and snoring is benign, meaning we've all listened to our spouse snore. My wife says she doesn't, but honest to goodness, she does. Not often, but she does sometimes, and I know I do too. And she rolls me over. How many of you haven't rolled your husband over sometime with a little kick? We do that. We know that. And snoring may keep your spouse awake. But snoring at its worst, when snoring gets bad, and almost always in America caused by obesity, again, because when we get fat, guess what organ grows bigger in our mouth? Our tongue gets bigger. Can you imagine that? When you get heavier, your tongue gets bigger. And when your tongue gets bigger and you lie on your back, guess where the tongue goes? It falls backwards. That's right. So I always do. I'll do you my 20-second version of obstructive sleep apnea, but it goes something like this. Your spouse is lying in bed and he goes, got it? You know how it looks. If your spouse is doing that, you need to talk to your family doctor about perhaps his having a sleep study. Now, the sleep study takes you in and they wire you up, put wires on your head and put monitors all over you and do your EKG, and they have enough stuff that I don't think I could even go to sleep in a sleep center. But you hope that you can go to sleep when you are about ready to drop $2,000 on some kind of test. Anyway, the sleep study measures all those things, and it watches us how many times a night we stop breathing. And it gives us a number called our AHI, which is our apnea hypopnea index, meaning how many times did you stop breathing or didn't breathe very well in the night. And if it's up above 10 or 15 times an hour, then you're not getting good sleep. You're not getting good REM sleep. Sleep's been studied so well now. We know we have times where we have stage 1 sleep and then REM sleep and stage 2 sleep and then REM sleep. And REM sleep is where we're really deep asleep, and our eyes, if you could watch them, are doing this late at night, and we're usually dreaming deeply at night when we do that. And it's really important for us. People who don't have good REM sleep end up with all the stuff I talked about: insulin resistance, immune deficiencies, gaining body fat, insulin resistance, the whole 9 yards. It comes with bad sleep and with sleep apnea. And sleep apnea can cause cardiac arrhythmias. And interestingly, sleep apnea, in my experience, causes high blood pressure in people that would not have high blood pressure otherwise. So this is a big deal. And it's a fairly new disease in the last 20 years. And there's some sleep specialists in town, and every one of your doctors should know somebody who does those kinds of studies. And if you have a spouse who has that, they should consider having a sleep study to find out if they're stopping breathing at night. I've seen some miraculous cures of obesity and all sorts of things in people who get cured from their obstructive sleep apnea. Now, if you're too fat and you have obstructive sleep apnea, what's the treatment to make your tongue get smaller? Lose weight, get smaller. And I find often it's only 5 or 8 pounds. It ain't much. You know, it's like the tongue gets smaller first and everything else comes off later. So don't be dissuaded by the fact that you're 40 pounds overweight, for heaven's sakes. Lose the first 10 and see what happens to your sleep. Almost everybody to a person, to a man or a woman, will say they sleep better when they're more physically fit and they are leaner. And again, remember that obesity is one of the causes. Now, it doesn't mean that only fat people get obstructive sleep apnea, because I've seen some guys who are fairly skinny. It's the way their mouth is built. Their palate is long and sticks back, and the uvula is long. The little thingy that hangs at the back of our palate is long. And that, plus a bigger tongue than normal, falls into the throat and blocks off breathing and causes poor sleep. So the message in all of this is, let's sleep. Let's make sure that we're sleeping. Let's watch our spouse as much as we can. Now, if you fall asleep before your spouse goes to sleep, then obviously you have no idea what your spouse is doing. But we might even, if you think you're not feeling well and you're waking up not feeling rested, you know you've gained 20 pounds the last few years and nobody ever looked at your sleep, watch your spouse. Pay attention and see if they possibly have obstructive sleep apnea. The therapies for obstructive sleep apnea, there's several good ones. The easiest one, believe it or not, is a thing called an oral appliance or a tap appliance that you put in your mouth, and it pulls your teeth forward and your tongue forward. You have a little crank thing that cranks it out and pulls you forward like this, so your tongue can't fall into your throat. It costs about $600 or $800, and there's some dentists in town that make them, oral surgeons, and they're called TAP appliances. I can't remember what the TAP stands for, but it doesn't make any difference. It really helps some people quite a lot, and it's not a big deal. Now, some people can't be helped by that kind of appliance, but they're really helped by a mask, wearing a mask at night. And I know it doesn't sound too good for your marriage, doesn't say to look like a spaceman all night or a spacewoman, but the mask basically sits over either over your nose or over your mouth and your nose, and as you take a breath, as you begin to pull in like I just did, like you're ready for your breath, the machine goes and blows air down into your airway. It's past your tongue, and you breathe well. And I know a number of people who use a mask every night, and they really feel lots better than they did before. But the vast majority of people can be treated for sleep disorders by simply losing the body fat that they accumulated over the last 20 years. Okay? So if you've gained a whole bunch of weight and you're not feeling well, say to yourself, I wonder how I'm sleeping. And if your spouse is, you're snoring and your wife's rolling you over 6 times a week, you say to yourself, I wonder if I'm blocking off altogether and not sleeping well. Because people who don't sleep well get poisoned, basically, internal poisoning. The last poisoning I want to talk to you about is near and dear to my heart, and it's something that I've felt for many, many years. I had people, dialysis patients, who were so ill, and sometimes I'd put them on antibiotics because I didn't know what to do, because I knew they were on a slide and going downhill. And they'd get well. And they didn't have any infection. And I'd say, what did they have? Why did they get better? What did I treat with my antibacterial regimen? Sometimes antifungus things, sometimes antibacterial things, sometimes antiparasitic things. And people would get well. And I didn't understand why they got well. And I kept saying, it's got to be stuff down in their gut, in their tube, that's out of balance somehow. And it's making them sick. And I gave them an antibiotic, and they got better and got 4 more years of life that I knew they weren't going to have. And when you take care of people who have chronic illness, you know when they're going downhill, and you hate to lose them. I used to lose people. They were my dear friends in these dialysis clinics all over South Texas. And I told you, I went to Uvalde and Seguin and New Braunfels and Eagle Pass and Carrizo Springs and all those places. And they were my friends, but I'd often watch them going downhill, and I'd find that if I gave them antibiotics sometimes, they'd just turn the corner and get better. And I had no idea what I treated. They didn't have a cold, they didn't have the flu, they didn't have anything. They were just going downhill. So over time, I began to learn that the problem was something had to do with bacteria in the bowel. And I want to talk mainly here to the older set of us. That's people over 50 in here, okay? So you can wear the hat if you wear it. And I think that the evidence is increasingly clear that first of all, everything gets older as you get older. You know, your skin doesn't look the same as it used to. Nothing looks the same when you're old as it did when you were young. And in fact, you say, well, does my tube that begins at my mouth and ends down here at my anus. Does the tube look the same in a 75-year-old as it does in a 25-year-old? And logic would tell you what? Of course not. Of course not. Do we act like it does? Sure. I still think I can go down and plow into a big dinner at some smorgasbord place and eat just as much as I ever did. I think I can until I'm on the car on the way home. You know? How many times? We just can't do it the same. And the reason is because the tube from here to there is changing. And the way it changes isn't in a positive way for us, as we know. And there are books written called books like Death Begins in the Colon or Death Begins in the Bowel. You can look them up and read them. And it's because people for centuries have observed that something went wrong in their tube. First thing is they recognized they couldn't eat all the stuff they used to eat without feeling sick. And then they had changes in their bowels. Sometimes they used to, for years, they had normal bowel movements, and then after that they had mushy, loose stools or cramps or gas or things. And doctors had to come up with names of it, and they called it Irritable Bowel Syndrome. You know, everybody's heard that one, right? So over here we've got normal bowel movements, then we have Irritable Bowel Syndrome, and over here we have Crohn's disease and ulcerative colitis, the bad diseases of the colon. But it's all a big spectrum that goes all the way back from normal to very abnormal. So the bowel is changing, and I guess I would have to say that the best way to explain it is that the cracks in it are getting a little wider. The bowel is supposed to absorb nutrients for us. It's supposed to absorb everything we need to make us strong and well. And it does pretty well with that, even when we're 95. We still absorb things, kind of. The bowel is supposed to keep out things that weren't supposed to get into us, right? It does that pretty well for the first 50 years. And then the evidence is accumulating in good research laboratories, even in our own medical school, that stuff starts getting into our blood that we didn't intend to get into our blood when we're in our 50s and 60s and 70s. And our immune system then has to respond to that. Remember, the immune system is our defense system. Starts in our nose and our sinuses, in our mouth, all down our esophagus, all through our small intestines, all through our large intestine. There's about 1/4 of an inch of white blood cells lining that whole tube, fighting off the world, if you will, trying to keep us safe from everything that's out there that's coming through the tube. And we put all kinds of things through the tube. We know that. We eat all sorts of stuff and drink all sorts of stuff. And I suspect the best way to think about this, we call it dysbiosis, meaning something ain't right down there. Okay? Something ain't quite like it used to be. And we can't define it very well, but we know it's so. And I guess the best way to explain it is that the cracks are getting bigger. And you say, well, what can I do about that? You know, you can't get plastic surgery on your bowel. You may make your face look a little tighter, ladies, but you can't make your bowel look tighter. There's nothing to do down there inside us. And I think that I've worked for the last 15 years with a neat doctor named Larry Hoberman. He's a Jewish fellow who was my first resident out at Wilford Hall 40 years ago. And I told him this story about taking care of dialysis patients, giving them antibiotics and antifungal drugs and fibers and all sorts of stuff. And he kind of laughed at me and he says, well, you may be right. He says, but because you did get to take care of awfully sick people, Dave, more sicker than I did. And he took care of pretty sick people. And he showed up about 6 years or 7 years ago with a bottle in his hand that he called Endomune, E-N-D-O-M-U-N-E. Maybe some of you in here have seen it or have taken it. And Endomune is a probiotic. And we've heard probiotic. That's a new word in our vocabulary the last 10 years, isn't it? Probiotic. Probiotic means stuff that ought to be growing down there that ain't growing there anymore. And Larry's probiotic had 10 germs in it. And he and a guy from the University of Wisconsin Veterinary School had invented it together. And he went to a veterinarian of all places, you know. You say, wow. And so the Endomune has the wisdom of a veterinarian in it. And the veterinarian had told him when he talked to him on the phone one day, he said, well, we've known about this in cows and chickens and pigs for years. to take care of them good and get good meat production and good egg production, you take care of their bowel. You put a little bit of tetracycline in the food, and you make sure it's got some probiotic stuff in it, and you'll get lots more pounds of meat per month out of a cow. Why do you guys not do that with human beings? And Dr. Hoberman said, gee, I don't know. We just never thought about it. Well, believe it or not, he walks into me about 6 or 7 years ago and has his bottle of Endimune, just grinning from ear to ear. And he's been out marketing it now on the streets, and it's now in H-E-B of all places. You can get Endimune at H-E-B and at Cost Plus Nutrition and a lot of the pharmacies in town. He's selling it around the world. And the truth is, we've heard other people, have advertised various kinds of probiotics to it, and we can buy a line and things like that up at H-E-B and other pharmacies. And it appears that adults over age 50 have bigger cracks in the tube and need to make sure that the bacteria that are down there are the kind that make the free fatty acids that feed your mucosal cells and keep them as healthy as they possibly can be. And also, of course, we travel all over the world. We marry people who were not us, who came from some other part of the world than us. And as Dr. Hoberman has taught me often, our bowel is established. The germs that are in us are established by age 3. And our immune system gets used to those germs by age 3. And it then determines after that what is foreign to Bob or Bill or Mary or Susan. And we marry people from other cultures. We travel to far parts of the world. We eat stuff that we never saw before. We kiss people we never kissed before. And we trade germs. And so we end up with stuff growing down there that wasn't part of what we had in us when we were 3. So part of the problem comes from germs that are not ours, that are there. And part of the problem comes from a bowel that's getting older and has cracks in it. And that's, sorry. My crack just sprung here. I lost my... And so the secret, I think, for us to manage that is probably some combination of antibiotics, probiotics, prebiotics, and fibers. Fibers absorb things to them and take things out in our stools. We've known for years that taking Metamucil, psyllium, P-S-Y-L-L-I-U-M, psyllium fibers, psyllium husks, that lowers serum cholesterol levels by about 30 milligrams percent to take a little bit of psyllium every day. Say, how could that possibly work? How could that make my liver make more cholesterol? Well, the truth is, the psyllium takes stuff out to the stool that was not getting absorbed into the blood and going to the liver. So fibers, probiotics, prebiotics, which is food for the probiotics, all those things are probably important to us. And I want you to read about them. I want you to pay attention to the literature on this subject. Listen to your own bodies. There may be one probiotic that's better for some of you than others. We all come from different places. We are all immune. Our immune systems are different. But it looks like the 8 or 10 germs that are in Dr. Hoberman's Endimune stuff are the ones that ought to be in everybody's probiotic. And I think they're good for people. And I think it's had a salutary effect on me and my bowel. And I think it probably will in yours too. You can pick that. Take some kind of probiotic if you're over age 60. Probably if you're in your 50s. Now, if you take it and it makes you sick, stop it. And the question has always been, how long would I have to take a probiotic before what's growing in me is really different than what was growing today? And Dr. Hoberman and I argue about this all the time. The question is, if you had a whole field full of Holsteins, black and white dairy cows, and you ran 2 Guernseys in every month, the question is, how long would it take before your herd looked yellow and white and black and white? And the answer for our bowel is a dang long time. In other words, I think it's hard to change what's growing down there simply by taking a probiotic. And that's why I believe some people who have weird diseases, and you say, what diseases are related to dysbiosis, if you will? Too many bacteria, wrong bacteria, too many cracks. What diseases? I think rheumatoid arthritis, psoriasis, eczema, chronic headaches, chronic coughs, some asthma and wheezing syndromes, Just about every degenerative disease of mankind probably starts in the bowel with poisoning. And the immune system is trying to respond to it and is doing its best. And the immune system often makes chemicals that cause funny things like that eczema that used to be up here, or that psoriasis that's on my elbows, or the chronic bowel thing, the chronic rheumatoid arthritis, joint pains, and so forth. This may sound like heresy, and I'm getting to the end of my time, but I thought of all the things I could tell you here, I think this stuff is really important. And I would urge you to read about probiotics, read it, try a probiotic if you're in our age group, our 70s, 80s, and 90s. Try it if you're struggling with it. If you're doing great already, don't ride a different horse. Okay? Stay on the horse you're on. But if things aren't quite right, and you don't know what's not quite right, take a probiotic. It might be your tube and your immune system trying to save you. And the immune system is everywhere, remember, in that 36 feet. The immune system is lining the whole thing, and it makes sense that the immune system would get messed up sometimes, trying to respond to our bacteria, the changes in our bacteria, and the endotoxin and exotoxin that get through there. I would tell you 2 anecdotal stories, and I'll finish up. One of them was a book that I read that changed my life, and I probably told you this book. And it's good reading, in fact, on this topic. I encourage you all to go get this book and read it. It's called The Yeast Connection by Dr. Crook. He was not a crook, okay? He was a GP down in Alabama, and he wrote a book about 40 years ago called The Yeast Connection. And the way it went was something like this. He had women who were coming into his office all the time with vaginal yeast infections. Most of you girls have sometime in your lifetime had a yeast infection, usually caused by taking antibiotics, right? We men don't have vaginal yeast infections because we lack a vagina, but the fact is that we grow yeast in our gut too, okay? And the truth was, Dr. Crook kept taking care of women that were having to take suppositories and things for yeast infections, and he finally got tired of it, and he put the stuff that was in the suppository in a pill and gave it to him by mouth, knowing that that pill was not absorbed into the blood at all. Okay, nystatin is a totally unabsorbed pill. If you take a gram by mouth, you'll catch a gram down here 2 days later. With me? So it's an unabsorbable chemical. But he gave it to them because he figured that some of it would go through them and they wouldn't get yeast infections anymore when they took antibiotics. So he did that, and what he noticed was, number one, the women never came back with yeast infections anymore. That was kind of cool. It was good for them and good, probably not so good for his office revenues, but it was good because he was a noble guy, okay? And the second was that he noticed when the women did come back, they would say things like, Dr. Crook, you know that eczema, that rash I always had on my neck? He'd say, yeah. And she'd say, well, it went away with that stuff you gave me. And he'd say, well, that doesn't make any sense. The stuff doesn't get in your blood. It's not absorbed at all. She says, well, I'm just telling you, it went away right after you gave me that stuff. And the next lady came in, and it was her headaches that went away. And the next lady came in, it was her chronic cough that she had that went away. And he finally, after about 10 years of seeing people come back with it, he wrote a book called The Yeast Connection. And the reason I want you to read that book is not because it's true about you, because it teaches you about dysbiosis and how things that grow in the bowel can cause symptoms in other places. Joint pains, headaches, rashes, nutty stuff, coughs. I had a lady over at Benefit Planners some years ago, I'm almost done, but who had asthma and was taking 5 drugs for her asthma from one of my best friends who I consider to be the best pulmonary doctor in San Antonio. And she was taking, and I had compassion on her. She was going to have to quit her job. She was 46 years old. And I told her my story about yeast. And I told her to read the yeast book, and I wrote out a prescription for this nystatin stuff, which I consider to be one of the most benign medicines ever invented, because it doesn't get in your blood, right? You take it by mouth, and it just goes through you. But it kills yeast in your tube. Anyway, I gave it to her, and 2 weeks later, she was off all of her asthma medicine. Now don't do that, without talking to your doctor, okay? Don't do anything coming out of my lectures. I'm just telling you that her wheezy syndrome with coughing and asthma and chronic cough was all coming from a yeast that was growing in her bowel that was triggering her immune system to make a cough. Just like the lady with the eczema, just like the people with psoriasis. You all with me on this, how this can happen? Read the books. Stay in tune with things like dysbiosis, words like that, where you study, because if it can happen with yeast, it can happen with different bacteria. And you and I have 370 odd species of bacteria and funguses growing down inside our tube, whether we like it or not. Most of them have been doing us good most of our life. But as the cracks form and the aging processes happen, dysfunctions occur. And I'd ask you to entertain in your mind, am I being poisoned from within by my own bacteria or my own tube as it gets older? And I think the starter point is a probiotic. I'll go along with Dr. Hoberman on that one. But some people, the way I've done it for a long time, is say, well, I'm going to take tetracycline or nystatin or some kind of antibiotic thing or antifungal thing first, kill off what's there for 2 weeks, and then chase it with the probiotic, hoping that I can get rid of some of the Holsteins before the Guernseys come in. You with me? I know that's kind of a bad analogy, but it's really true. You know, it's sort of like if your wallpaper was all solid and you were going to try to paint over it, you know, how long does it take to paint over the wallpaper that has all kinds of relief on it, you know, with roses sticking out at you? It's hard to do it. And I think it's hard to change what grows inside us. But I think we start with things like probiotics and fibers. And if you're, like I said, if you're riding a good horse already and everything's going good, don't go home and change. But if anything isn't quite right, consider this as the cause of it. I think I'm right at 10:30. I wish I had more time to talk about it, but it's an important issue. So we've got 6 or 7 areas. We have body composition, work on it. Usually it's good muscles, good bones, and good fat. And fat is bad for you when your insulin level's too high. Go to your doctor and measure your insulin level. Okay, if it's above 10, you need to do some work. Usually getting more fat out of your liver. Good nutrition, good protein intake every day for all of us. Controlling our calories coming from carbs, fats, and alcohol. Got me? Number 3, good physical activity and good fitness. Every day, every calorie expended through the first 2,000 is an extra few hours of life for us. Let's look for the life, okay? And D, let's don't get poisoned by stuff if we can help it. Not by our doctors, not by prescription drugs, not by over-the-counter drugs, not even by vitamins sometimes. And let's not get poisoned by our own colon bacteria. Let's address that and read about it. Be well read in these areas. And then pray, and then decide what to do. Always pray first. Always talk to the Lord about these things. Don't go off and do something half-cocked. Don't take any pill your doctor gives you without praying about it as you do it, okay? I'm in a body of believers. I can say that here. I can't say that always across my desk at home, but I can say it to you guys. We have a great Lord who loves us, and he knows us one by one, and he cares about us one by one, and he hears us one by one. Let me pray for you, and I'll send you out of here. Father, we thank you for this 4 weeks together. I pray that the things that have come pouring out of my mouth will have been of some value to some. Thank you that we are fearfully and wonderfully made. Thank you that our bodies are the temple of the Holy Ghost and that you dwell in us and you speak to us and you give us wisdom about how to care for our bodies. I pray that we'll take these things that we've heard, use them, and as always, we will use our bodies to your glory, that we will talk with you, trust you, to help us make decisions in the care of ourselves. I thank you for all of them, for their eye contact. I pray that you'll take them safely to their homes or to their worship service. And if it be your will in a year or two that we'll be able to do this again together and look at new things you teach us about our bodies. I praise you in the name of Jesus, our Savior. Amen. Amen. Thank you all, you guys. Blessings to all of you.